of time talking to walls.
I think one of the really important things I learned from doing this project was I saw her diagnosis before we went to go meet our patient, and I definitely had a stereotype about what I was going to see and what that was going to be like, and I was completely wrong. So I think that was really important for me to learn now that, my patients that I will see in the future, they're not something that I can just classify and put into a box.
I'll go through the whole thing because we went about 3 times before we actually came in and started editing, just because of timing issues. We came in and we looked through everything and we were really confused because you showed us that one video of the girl with brain cancer, and it was like her disease was her life, and we went to see her and she was healthy, and we were very confused because we kept going and thinking we need disease, we need to learn about her disease, we're going to be doctors, patient project. So it's like we got this, right? And then we talked to Deb and we looked at all the footage and we realized, well, we're looking for this, but we need to actually show everybody this.
I guess it also changed how I thought about her. Because at first, the empowerment, I thought she was, like, she took it on, she pulled her bootstraps up, and she just did it herself. But really what it was that all the help she received from her community and from the people in her support group and from her mentor giving her emotional support and they all gave her the momentum and the safety net to take care of it for herself then when she felt comfortable.
I like her immediately, and I bet she compels the people around her. I mean, there are certainly lots of other patients in similar circumstances whom the community does not have such an outpouring for. So part of that must be how she is in the world, and you just root for her from the minute you meet her. She's a very engaging person.
When we were there filming, I didn't pick up on a lot of the subtleties that I did when we were going back and going over the film and editing. There were just certain things that I noticed about our patient's wife. She was sort of in the background, but her different mannerisms when the patient was talking, you don't pick up on that in the moment, but when you go back, you realize a lot more is happening than you realized when you were there.
We really see that how multifactorial their disease is and how it affects multiple parts of their lives and their livelihood, everything from their job to moving around the house to making dinner. So as a physician moving forward, I'm much more likely to think of the kind of extra clinical aspects of the diseases that I see and the disease processes.
As a physician, you need to have a better understanding of what happens with your patients, like when they leave your office. They don't stop being your patients when they leave your office. So I think I learned a lot I was very surprised about some of the things, all the complications they have to deal with.
I think that for me personally, like my patient was super religious, and I'm not really that religious personally. So I didn't really have a full understanding of how religion could help guide someone through trying times and through chronic illnesses like my patient has. And now I've realized that it's kind of what keeps her together. So I think I'm more likely to take a spiritual history, and I think I understand like more fully the importance of a spiritual history from when I started the project.
For Hershey, I pack candy. And if you ever watch that clip with I Love Lucy, it's exactly like that. Your first day in there, stuff's going everywhere, and it's really funny. It's really it was a great job, a wonderful job. Well, I was diagnosed.
People find their catharsis in many ways, whether it's like creative or what have you. And she just really throws herself into like, moving forward with like, she always would talk about like trying to find cures, and she said, I do this for the Leukemia and Lymphoma Society. They go to Harrisburg, to the state capitol to talk with the legislators about, allowing experimental drugs to be released to people who are kind of end stage. And I don't know, I mean, she's just very, very active, and that's like her way of, that's like her catharsis. It's her.
I'm struck by the contrast between how active she is and how little information she wanted. And that's an interesting combination.
Yeah. I think that too. I mean, she's just real, like, feet on the ground, like, I don't know, like Central Pennsylvania woman. Like,
yeah, gritty, sort of.
Yeah. And I think that, like, she's very, at first she uses her humor to kind of push the situation away from her, and I think that is kind of part of how she's healed. There's still like this very open, raw piece underneath. And I mean, his words were, she was a psychological mess. She was like, and I think maybe that's the place that she doesn't need to go anymore. You know, that it's okay to leave that in the past, and, you know, maybe it's healing just to kind of ignore it and let it.
Yeah, and good for you for recognizing that your film would be more truthful if it was in there, but it doesn't need to be. You know, you learned what you need to from it.
I can specifically think of one encounter with my patient where she showed the most vulnerability, and she was really down that day, and it was at our medical, it was at her medical visit, and we were running late, and I was all concerned with getting everything together before the physician came in, and she was speaking to us about a lot of difficult stuff going on in her life, and because I was so focused on external things, I wasn't really paying attention to what she was saying. And it was only when we went back and watched the footage again that I realized how vulnerable she was being, and just her demeanor, how sad she actually was. And I kind of wanted to kick myself for not being present and not responding appropriately and showing empathy like I should have. I feel terrible about that, and like watching the footage, I was like, oh my god, I'm a monster. Like, I can't believe that I was so insensitive. Like, I thought it was, I won't lie, I thought it was Addie at first, responding to what Dottie was saying. I was like, I can't believe, like, in my head, I was thinking, I can't believe she's responding like that. But then I realized it was me, and I was like, I cannot believe that I actually, like, was that, like, unaware of what was going on. So I'm certainly...
But she thought I could be.
I know. How terrible is that?
So one of the aspects that I didn't think about coming in was the long-term relationship you can form with your patient. You spend a couple months with your patient. You do about one interview a month. You spend a couple hours at each interview. And that's all I thought it would be. You know, you get to know that person, you make the project about that person, and then you're kind of done. But our patient was awesome, and we formed a really great relationship over those months. And we actually met after the project just to kind of hang out and to give her back her photos and to talk about what she thought of our video. And we talked about life. We talked about my how wedding planning's going, and how, you know, how she's changed since the project's over, and how school's going for us. And so you have a real ability to form a tight relationship with somebody that is long-term, and it's not, you know, it doesn't need to end at this project. And I found it really fulfilling. I think Wendy did as well, and I think Nancy also finds it fulfilling, because, you know, we're going to schedule another meetup, and we're going to go to her barbecue at her farm over the summer. So yeah, it's, you know, it's something that you can really take forward and make it bigger than just a video. Or it's a transformative experience, not just for us as future doctors learning how to interact with patients over time, but it's also important for the patients. It helps them heal a little too.